Chairman. My name is Ju-Young Kim from Gyeongsang National University of Korea. Today I will be talking about my study entitled Computational Simulation of Femoral Neck System and Additional Cannulated Screw Fixation. Femoral neck fracture is a common type of hip fracture, accounting for half of all hip fractures. In recent years, there has been a trend of increasing incidence of femoral neck fractures among young adults. Younger age groups tend to experience fractures due to high-end trauma with a tendency for fractures to extend in vertical patterns. In particular, power type 3 femoral neck fractures have a high rate of fixation failure and non-union due to the shearing forces and instability. To prevent this problem, precise anatomical reduction and robust internal fixation should be performed. The stability of the fixation is crucial for bone union, so the newly introduced instrument, the femoral neck system, is designed to overcome the limitation of the traditional multiple cancellous screws. Compared to the multiple cancellous screws, there are anticipated limitations in terms of fixation strength and stability against shearing force and rotational deformity due to the concentration of load on a single device and a narrow fixation cross-section area. This study provides theoretically reference data through a comparison of fixation devices, focusing on the biomechanical benefits and characteristics resulting from the additional fixation of cancellous screw to the FNS. We utilized the medical record processed through CT scans provided by the Korean institution. A total of 30 individuals consisting of 15 males and 15 females were selected to represent the average population. A three-dimensional proximal femur model was reconstructed using a mimic software. A femoral neck cutting plane at the 70-degree angle to the horizontal plane was added. Under the assumption of working, a rod was applied to one leg, set to 1,950 Newton, which is 3 times of the body weight for duration of 1 second. The FNS and cannulated screw were implemented in the program with their actual dimensions. In the conventional multiple screw fixation technique, which utilized a reverse triangular position, we developed and applied a novel method by replacing the inferior screw with the FNS, combining the advantages of both techniques. However, interference occurs between the screw position in the posterior superior region and the anti-rotator screw of the FNS. Without modifying the pre-established conditions, there has insufficient space to accommodate both screws simultaneously. Therefore, the experiment was conducted with a single cannulated screw fixation. The safe zone was found to be wider in the anterior superior region, leading to its application in that area. Additionally, differences in the thread design of the cannulated screw were expected to influence the result, and this factor was analyzed accordingly. The material properties required for the computer simulation were applied as intrinsic value using the density, Young's modulus, and Poisson ratios specified in the corresponding table. The experiment was conducted by dividing the sample into 5 major groups. 3 key outcome variables were analyzed to assess the result. This result represents the forcing acting on the implant. The highest concentration of the force was observed at the junction of the FNS. In the group using FNS alone, the peak stress was 786.83 megapascal. However, in the additional screw fixation group, a reduction of 35% in bone misses stress was observed. The bone misses stress acting on the bone was concentrated in the inferior portion of the femoral neck. In the FNS alone group, the bone misses stress was measured at 380.14 megapascal. However, with the additional cannulated screw fixation, a reduction in stress was observed. The following experiment investigates the rotational deformation when a force is applied. When observed from the side view, rotational deformation at the fracture site can be visually confirmed when a force is applied. Additional screw fixation reduced the rotational deformation. This suggests a theoretical basis for the improvement in rotational stability. The experimental data confirmed that fixing a 7.0 millimeters full cannulated screw to the FNS provided the greatest biomechanical advantages. In young patients with femoral neck fractures, osteosynthesis is preferred over arthroplasty, although there is disagreement regarding the fixation method. However, there is no dispute that stable fixation with maximum fixation strength contribute to bone union. Therefore, it is important to be aware of a clinical option that can enhance stability. In a study involving 395 individuals, the results indicated that the anterosuperior portion is safer, while the posterior position carries a higher risk of vascular damage. However, clinically, achieving a perfect anatomical reduction is often challenging, and residual posterior tilt is commonly present. In such cases, it is important not to insist on the narrow anterosuperior position and to recognize that, depending on the situation, fixation in the posterior superior region may be more advantageous. Simulation studies have a limitation as they simplify the model by excluding various factors such as the surrounding muscles and ligament. However, with site modification in the application, they hold infinite result potential and therefore they should be effectively utilized. In conclusion, this study confirmed that the use of FNS along with a 7.0 millimeters full-threaded cannulated screw in the anterior superior position enhances biomechanical stability in unstable femoral neck fracture. This study was published in JMT in 2023. Thank you.